if you're smelling toast, it's probably not going to be good, right?
Well, that's a myth, but...
Is it a myth?
We ask patients about their poo all the time. I've had several people being embarrassed to tell me they've had diarrhea or something like that, but that's crucial. I need to know that.
Whatever I associate going into a hospital with is like, oh, I've got a pain in my leg, or I'm feeling under the weather, I cannot be bothered. Get me out of here as soon as possible. What was that like the first day where you're like, oh, I'm showing up to work. This is work.
Yeah, it's really weird, especially as we get scrubs.
Yeah.
For uniform, and being sort of, I'm not staff, but I'm kind of considered staff, and it's a bit like, I'm allowed to go in this room.
Yeah.
I'm alled to see that on the computer.
Damn. Yeah.
So that's a bit weird.
But like, that must be the same for like the cleaners. Like, because I feel like as in a hospital, there's such a vast amount of like different people with different backgrounds going in, not just the people who work there, right? I mean, I have been in and out of hospital recently for the past 2 or 3 weeks. I've had all 4 wisdom teeth removed. Crazy. It's not often that they were just like, let's get this all out on the same day. Let's go in. So I'd like to say that I probably have more, in these last 2 or 3 weeks, I've got the most respect for you than I ever had.
Oh, thank you.
Yeah, so how was that like then going from, visiting the hospital because you might be sick to then like showing up, oh, this is my job,
Well, I'm fortunate enough to I've never been in hospital.
Wow, yeah. Not even like for a little cold or like anything. You never went to the hospital before?
Well, when I think I went twice to A&E when I was a kid for like really random things. Like one time I fell off a roundabout, banged my head, and then I was sick when I got home. So my parents were like, oh my God, she's concussed. I just had a stomach bug at the same time.
Fell off a roundabout. Now, do you mean the thing in the playground? Are you talking about a roundabout, right?
A playground. My dad pushed me really fast. I spun off the edge.
You weren't like driving at 7 years old, right? No. Okay, damn. Yeah. So, and do you have like, does your family have a medical background? Do they study medicine?
No doctors, but my mum's a speech and language therapist.
Cool.
So
I could do with speaking to her now. I've got these braces in. Let me know.
So she's played a big part in why I'm doing what I do, I think. Because if you've got a medical person in the family, it's way more likely that you'll gravitate towards it. I'm not sure why.
Well, like that's with anything like, oh, my dad's a carpenter, I'll probably go into that, right? But yeah, it's definitely a lot more work than say if my dad was a baker, all I have to do is, learn how to roll a couple. But it's probably not that simple. But, to follow in that footsteps, you're studying for 7 and 8 years.
Yeah, I mean, she tried to put me off. I was very, very lucky to have her because obviously she works with doctors every day and she was able to get me work experience when I was 16. Wow. And I think part of her reason for doing that was like, maybe this will, it's going to be a hard career. Yeah. So try and put her off if I can.
Yeah, get her in early. 16 seems so young to be going into a hospital. So you're going into hospital, 16, probably just doing your GCSEs. How was that?
Very exciting.
You were excited by that. That proves you probably want to get into it. Yeah. What are you thinking? Oh,
I don't know. I mean, it's kind of what you were saying before. It's like I'm on the other side. That's very weird. And it's like I'm allowed to see all these people who have come into hospital and I'm allowed to hear about their stories and their problems. And it was a privilege then. It's still a privilege to be in that role, I think.
What were they allowing you to do at 16?
Nothing. I was just following them around. I still just follow people around. Let's be honest.
So if that wasn't a title, you'd just be like a little stalker, right? Just kind of like, But you're picking up information, you're learning from people. And how has that gone now? Like, so are you like 19 or like 20?
I'm 20.
You're doing probably a little bit more than walking around following now, yeah?
Well, I am allowed to interact with patients now, which is amazing.
Yeah.
But what we do as medical students is very different from being a nursing student. Nursing student is essentially working without being paid.
Right.
Like they sort of do. shadowing a nurse. I think they have a nurse as a mentor, and they sort of do the same jobs that they would do in a day.
Okay.
But for us, we have a list of things that we need to get signed off in a week.
Okay.
That might be taking a history from a patient, examining a patient. Got to do a certain number of those a week, but that's just for me.
Okay.
So when I do those things with patients, it's not really, I mean, sometimes it benefits them, but it's not for the progression of their treatment. It's just so I can practice.
Right. Okay. So sometimes you repeating something maybe a doctor has already done.
Yeah. Absolutely.
Okay.
Probably that another student's already done. Because there's like, in my group, there's 6 of us. There'll be 6 of us on a ward. And we're just going around being like, oh, hi, my name's Lauren. I'm one of the medical students. Can I have a chat with you? And they're like, no.
Yeah.
The other person has just talked to me.
Yeah, that's like the equivalent of like people who network. They're like, you're trying to get something out of me. It's like, there's no like natural intent here. No, that's cool. So, and then you've gone into that. How has that been? Because me being in the hospital, I was very high on, they put me under general anesthetic. I imagine being asked the same questions twice, and I'm like high off codeine. I'm like, am I in a dream? Did that just happen? That must be really bizarre. They're like, yes, these have been asked before. Have you ever had any like rude or not just like weird interactions with that? Where?
Yeah, I mean, you either get people. I mean, being in hospital is really boring, as I'm sure you've come to appreciate. So most of the time, patients are perfectly happy to have a chat with you, and most of them understand that we need to learn, and you know that practicing is the best way to do that. You do get patients who are, really ill for one thing, and just really tired. Yeah. So they're like, no.
Yeah.
But they're usually like, I'm really sorry, but I just don't want to talk. And I'm like, yeah, fair play.
Yeah, it's probably one of the two, isn't it? Like, yeah, it's really lonely, a place in a hospital. I remember being sat there on the bed. I thought it was amazing though. My experience was, I was fine, going to get my wisdom teeth removed, laid down. They put me on a wheel bed. So all I was doing was laying, but I wasn't even like ill at that point or feel bad. They just rolled me into the theatre, got general anesthetic, woke up and my teeth were out. It was an amazing experience. And all that was partly to do with, you know, people you work with and what you're going to do. Because when you hear like surgeons and, you know, doctors, how do you always stay like mentally there?
Oh my gosh. Yeah, no, that is probably the biggest struggle with it.
Yeah.
Because it's not, a lot of jobs are like this, but you, as you were saying before, you really have this sort of professional air about you, and you have to maintain that all the time, because even though you're not the doctor, you are talking to patients. I examine patients, and that's vulnerable for them, and I don't know, taking blood from them, things like that. And they still need to trust that you're competent. Yeah. So, and that you know what you're doing. So, like the whole day, you've got to be this sort of carefully cheerful but professional person. Yeah. Which is quite tiring. And then you have that side of it, and then you have a doctor who's like, oh, what's the treatment for this? Like you're just walking around like in front of the patient, or
just on like 200% speed. And
you're like
there must be quite a lot of funny moments. There must be a lot of characters, but you are going up and visiting people who may have just like not spoke to someone in 5 hours. They've been in hospital, none of their families are visiting them. It must be like in some ways a lot of pressure in some way.
Pressure, I'm not sure. It's nice, and I'm at a nice stage in my degree or my career in that I have all the time in the world to speak to people. Yeah. I don't have a massive long list of things that I need to be doing. Right. Well, I do, but not like a doctor would.
Maybe you should be.
So if someone is lonely or just wants to chat, I can actually do that at this point, which is nice, because you sort of lose that a little bit as you become a busy, overworked doctor, which is sad.
Yeah, no, it does. And some of them seem like non-human in the way, or maybe it's just because I was so high on anesthetic, but I was like, how are these people doing it? I remember just seeing a lot of people but then never seeing them again. In some places, like when I'm in a hospital, and this is probably a lot of patients, they have a lot of people have a lot of irrational fears.
Yeah.
And I feel like a lot of the jobs for people in the hospital is just calming people down. Do you think like that's something you kind of have to have in you, that like natural calming energy?
Yeah,
like,
definitely.
Yeah.
You have to be sort of calmly confident, I would say.
Yeah.
Not sort of too...
Yeah. Like, oh, I fucking fixed 2 hearts today.
Oh
You
my
can't really
gosh,
be
yeah.
glowing. You can't really be glowing.
No,
You just can't.
no.
We want a humble, calm, but competent doctor.
Yeah.
You know? Yeah. Yeah, I guess that's why it takes 7 or 8 years to become one. Yeah, I mean, I hear a lot of stories in like other countries where, you know, healthcare systems are even worse. Have you heard of like botched jobs where people get surgery done like by you know, a doctor, but they're not, you're like a newspaper doctor? It's like insane. What you probably won't know, but people like that, they're just probably learning off YouTube videos, right?
I don't know anything about this.
Yeah, no, I know, but
Yeah.
like that must be insane. But yeah, is there anything that comes to mind that like you've picked up on from when you started to where you are now? I know you're only halfway through, but like, yeah, where do you see yourself going? I know you want to be a doctor. Is there any like specific field you want to get into? You just want to be a doctor? I mean, I'm very naive in this. Maybe educate me. Like, where do you want to go to?
So it's the classic question everyone asks you when you're like, I study medicine. They straight away go, what kind of doctor are you going to be?
Yeah.
And I don't have to decide for about 3 years.
Okay.
But I'm pretty certain that I want to be an A&E doctor.
Very reactive, very anything could happen, probably less scheduled than any other doctor.
Yeah.
When I was in there, everybody seemed to know what was going on. I mean, that may be even, it's more pressure, more everything. Are you prepared for what that's going to be like? And I'm guessing you're already in that environment now, right?
Well, I've never done A&E before.
No, never done A&E. So you would just be thrown into that when you get it.
Well, I've actually got a 3-week placement in A&E coming up.
Cool.
So that will be my sort of see if I hate this kind of thing.
Yeah.
But I've been on various different wards and medical specialties, and a lot of them, because they're quite focused, you end up seeing the same conditions
right, okay,
on a day in, day out basis, and I just want the variety. I don't want to be bored. I hate being bored. And I mean, you probably wouldn't be that bored, but you couldn't be bored in A&E.
Yeah, no, for sure. But if you got the same 5 cases of like lung disease, I'm like, can we get some variation?
Yeah.
You know. But within that though, say if you were dealing with the same conditions or diseases, there are intricacies and things you can learn from different patients, surely. So for you probably even see that as fascinating, right? How like different. And do you think like that's what a good doctor I know all doctors probably qualified, but like the speed at which they are to like diagnose someone, the ability to like just judgment, you know, is it because obviously you measure a lot of these things, but you hear about cases where, you know, you can just take a look at someone and go, oh, that's that. Like there's some people, obviously, I don't know. Do you get what I'm coming on about? I don't know if you kind of...
I mean, we do say you can quite often tell when someone first walks in the room if they're well or unwell.
Right.
And you do start to develop a sense for that. And I feel like I'm starting to.
Wow.
When you go to approach a patient and you're like, okay, this is a sick person.
Yeah. And not like cool, like these guys are unwell. Yeah.
Yeah.
Oh, this guy's fucking cool. But yeah.
Fucking sick.
Have you talked to him? He's amazing. We should have a drink when you get out, mate. We should have... No. But yeah, so you've been shadowing these people. Is there anything else like you would always have to visit? And so you're going up to the bed, you're asking them these questions. How would you say, like, what's a doctor better than you at right now? Obviously the training, the experience, but like to a simpleton, like why shouldn't I trust you to do what a doctor does?
That's a good question. I think it's mostly just my knowledge is obviously much less than that of a qualified doctor because I've got 2 years left.
Right. Yeah.
But it's the experience and sort of that sixth sense that we're talking about. And yeah, so if someone comes to you with a certain symptom, I know what questions to ask, but they might pick up on certain details that I might miss, or their interaction will be smoother. Or they'll sort of just more quickly tune into something that the patient said, I feel like.
Yeah, and maybe one way you could do that is you could maybe have a little app where after you're done with the interaction, could you rate me on my boxing skills? Give me 5 stars.
Like when you get out, very NHS.
Yeah, maybe not NHS. Maybe do that in the private field. But whenever I get out of an Uber, they go, rate me 5 stars. And sometimes that makes me not want to rate them 5 stars. They're begging it for it a little bit. So maybe that's not a good idea. But that could be one way of the ranking. And is there like any competitive environment? Like, what is the culture in like that? You got your fellow medicine students you're working with, and like any certain power dynamics. Like, it all seems very relaxed as a patient. Like, how is it? That's
what we want you to think.
Yeah. It's all an illusion.
The dynamic's strange, and it's developing at the moment, and it's changing at the moment, I would say. Because there's always, medicine is, quite an old and traditional practice, I guess.
Right.
People have been studying it for ages, and there's been doctors around for ages. And there are certain sort of ways of acting that hang over from that, which is that the doctor is always right and they're the boss, basically.
Okay, yeah.
Whereas now we're moving towards an approach of we listen to the patient knows what's best for them, and we take into account them as a person and then their medical stuff as well, obviously.
Right.
But really use that to help them in the best possible way.
Wow. Okay. So it's less like objectively medical, but you now in modern age like take into account their living situation, like how they are as a personality.
Yeah.
Wow. Why do you think that it's gone down that kind of route? Just because we are becoming more empathetic and maybe more care? Why is that? You don't. There might not be that might not be an easy question.
Well, there certainly have been studies, but I can't quote them. But I think just it's been found that people get better quicker if you take into account their social situation and their personal situation as well.
Wow.
And treat them holistically and not just as a disease.
Yeah, damn, that's really interesting. I didn't even think that. So maybe I'm getting a little bit of a different treatment to Suzanne, who sat next to me. Maybe they even speak to me a little bit more different. They'll probably use like cool hip words with me because I'm quite cool.
This guy's cool. So.
Yeah. Damn. You ever like had like a genuine like good chat with? I know you probably have good chats with them, but you're like, wow, this guy, I could talk to this guy. Like, obviously you wouldn't because that's unprofessional, but I feel like a lot of people who come into contact with like disease and stuff, I don't know, whenever I've been in a hospital, I've always like found brightness out of such like a dark situation. I don't know. I feel like there's so many like sweet and just like wholesome moments you see in hospitals. Like, is there any like things you can remember or anything you're allowed to speak about? Because I feel like, yeah.
Let me think.
That's all good. Do you get what I mean? Because like, hospitals, everyone's in it together, especially the patients. No one really wants to be there, but I feel like you cherish the little things more when you're on that bed. You've been there for a couple of weeks.
Well, when patients thank you and thank the doctors and nurses and all the staff that are treating them, that it's unfortunately rare.
Really?
And that is amazing when that happens. When someone's like, I really appreciate what you've done for me. That's really nice. When patients get discharged, I get really, it's just really nice, especially if they've been in hospital for a while. My most recent placement was on the renal ward, which is kidneys. And those patients are usually really quite ill because, well, they are. And they've got lots of different things going on with them. And they can end up stuck in hospital for a really long time. So you start seeing them. I have 5-week placements at the moment, and some of the patients would have been there for the whole time. And seeing them get to go home, because you feel like you've been there, and for part of their journey, and you start to just really hope for the best for them, I guess.
Yeah.
So that's probably the best feeling.
That is, yeah. You probably wouldn't think, or I'm trying to remember if I thanked them now. God, making me feel bad, but I think I thanked them. But yeah, being stuck in a hospital for 5 weeks and getting let out, God, you probably forget what the real world looks like. Yeah, but a kidney problem, that can probably be very fatal in some cases. Imagine not being good. Yeah, maybe that's the case. If a patient knows they're getting out in the next couple of days, I need to treat these guys with respect. I'll be in and out in no time. But it's nice. Just in any job, it's nice to be shown appreciation. That's good. That's nice to know. Show love for your doctors out there, because they could fuck. Well, they probably won't, but they might fuck with you. But no, we've got a good doctor in here today. Ben, you ever had you been in hospital much? You ever?
Yeah, I recently broke my ankle about 5 months ago, I think it was. But I left it a month before I went to A&E.
Brilliant. Did you thank your doctor?
I did. He was pretty quick and nice with me, but yeah, he basically told me that I should have come into A&E 4 weeks earlier.
I remember you did that at work or something, and you just didn't go into the hospital.
Because I had a friend who told me it was a sprain, and she doesn't even study medicine, to be honest. But,
Brilliant.
But yeah.
I thought you could out that it was a medical student. I was like, Lauren?
No, she's a music student.
Damn, brilliant. Yeah, I probably wouldn't go to a music student for medical advice.
She said her dad knew medical stuff.
So,
that was enough trust.
Yeah. That reminds me, Ben. Lauren, maybe you could tell me about this. I see post-COVID, people are more eager to learn themselves about their health problems, and they look online. You may not, because you weren't in the hospitals 20 or 30 years ago, but do you see a more tendency for patients to think they know their health more? And is that a problem? Does it hinder your job in any way?
I'm not sure they think they know more. We call it Dr. Google when a patient has Googled their symptoms. But we all do it, don't we?
Yeah.
If you feel something's going on, you're like, oh, what's happening to me? You're gonna hop on your phone and try and Google it. And that sometimes you have the battle of them being really certain that something's happening to them. But from your knowledge, that's not the case at all. And it's often that they think they're really ill, and you're trying to reassure them that they're actually fine.
Yeah. Mine was the one that I was like, guys, you're giving me enough anesthetic. I need to go under, because I saw one video of a guy who was under general anesthetic, but he can feel it all.
Did you know that ginger people need more anesthetic?
I didn't know that. Wow.
I don't know why, but it's true.
So would there have been a thing on my form which goes give this guy more? What would have been said about me?
I don't know exactly, but it is genuinely a thing. I don't know why.
Yeah, because I thought
dose.
I thought his weight, and obviously I think maybe gender. I don't know. Maybe you can tell me. But yeah, gingers have in general, we react to things more, like temperature, other things like that. But I didn't know that with general anesthetic. That's crazy.
Yeah, you need more to knock you out.
So what if you've got someone with freckles, but he hasn't got ginger hair? Do you have to vet them? How would you categorically know they're ginger?
Well,
that's what I want to know.
You do make sure they're asleep before you operate.
Right. No, but before we get to that, how do you know someone's ginger? Nowadays, Lauren, you can't.
Well, that's so true.
If you could probably tell I was ginger, even if I dyed my hair freckles, right? They probably go off skin and stuff. But yeah, do you have any irrational fears? This will be quite funny to hear from a doctor that because you study it that will happen. But you're like, damn. Do you have any weird fears that make no sense?
Well, do you know what? Being a medical person can make you a bit of a hypochondriac sometimes. We call it medical student syndrome, when you've learned about something and then you start gaslighting yourself that you've got it. But also just panicking. So recently I've been experiencing palpitations.
Oh.
Yeah. Sounds scary. Probably nothing.
Okay.
Probably just stress related.
Right.
But in my head I'm like, I'm dying. I'm going to have a heart attack. Blah, blah, blah. And I'm like, I literally, if I saw myself as a patient, I'd be like, girl, chill out.
Yeah, have a bath,
Yeah.
chill out. Yeah, that's crazy that even you, but in a way, ignorance is bliss. So you studying about all these different diseases or symptoms, you're probably gonna be diagnosing yourself
Yeah, exactly.
more. That is crazy. And even talking to other medicine students, that's even worse.
Yeah.
God. Yeah. Have you ever maybe saved someone? So you've got a friend and he's like, oh, my knee bloody hurts, but I'll be fine. Like proper Yorkshire people, they probably should go into hospital, but they're not. Have you ever like kind of saw that in a friend going, you should go to the hospital? Like,
no, that hasn't happened, but sometimes we have to, if I remember vaguely at the start of first year when we started examining people for the first time, when we learn, say like a heart examination, we learn on each other.
Oh, wow.
So in the med school, we're like tops off listening to each other's hearts. And they say to you, it is unlikely, but it's possible that you could find something wrong with your peers. And like, if you're just signing basically to say, I'm aware that someone could find something wrong with me when we're doing this.
Seems quite bizarre, that.
I don't think it's ever happened.
Yeah.
From my actual experience.
Imagine you're like,
theoretically.
Yeah, you could be doing that on your friend. You're like,
shit.
I think you have cancer, Janet. God, that would be awful though.
Yeah.
But you gotta be honest with them.
Yeah.
God, yeah. That's it. That reminds me, like, doctors have to tell people the hard truth, even if it's really sad, right? That's a hard job. I mean, it's probably like also when you have to deal with the family, maybe there's a family there and like privacy and then letting people know in certain orders. I mean, I've gone through it with my mum dying at an early age. Like there's so much like nuance to it that probably the general public don't know about. I mean, is there anything that comes to mind that like you wish the public would know, maybe people who work in the NHS have to deal with? Maybe that's a big question, but with the amount of stress they're under right now, I think it would be quite nice to like highlight what they do for us,
There's, I can't remember what it's on, but there's a new drama called Breathtaking.
Okay.
I think it might be Channel 4, but you'll have to check.
Okay.
And it's a drama, so it's acted, but it's about the about the pandemic in the hospital, and it follows a team of doctors and nurses, and it really highlights the horrible things that they had to go through, such as PPE problems, not having enough PPE, not actually knowing what to do about isolating people, like the first COVID deaths and the first people, because it was a new disease and they didn't know how to treat it at the time.
Of course.
And it really shows you how scary it would have been.
Yeah. I didn't even think about that. It seems like such a long time ago now, but yeah, like pandemonium, everybody else is freaking out, but you're having to stay professional. Would that have meant that people like you would maybe have had to step up? Is there ever a case like during like a COVID or anything like that where medicine students are called upon? Like,
yeah, in COVID, the final year medical students were drafted in. They basically got speed tracked to being a doctor.
Wow, you must have felt fucking lucky, fuck.
Yeah. No.
No, not in the way dealing with COVID. But
yeah.
There must have been one or two salty where like, they get to go now.
Yeah. No, I don't think they were lucky.
Wow, no, not lucky.
No.
Damn. And yeah, that just fast tracked in. Can we take a look at what a breathtaking review, a shockingly vivid picture of life as a doctor during COVID. Yeah.
I would want any non-medical person to watch this.
Okay. Yeah.
And it's with caution advice, because it's very sad, as you can imagine.
But it's a series. It's acted. It's not like a documentary, is it? It's like
no, it's not a documentary, but it's
it's a good representation of what it's like. Wow, it's a 3-part drama based on Palliative care Dr. Rachel Clarksburg. Damn. Yeah, no, we'll give it a watch. Does it say what channel it's on? Just so people.
It's Channel 4, yeah.
Channel 4. You were right, Lauren. You should trust your instinct more.
So it might actually be based on a real person. I'm not sure on the.
No, man, it's not Channel 4. It's ITV. Sorry.
Damn, guys, go give it a watch if you wanna. You want to get good sense of what people like Lauren might be doing. Well, in a couple of years' time.
It's not easy watching, but
no, not an easy watch. Maybe not one for the morning cereal.
No.
Damn. Yeah. Also, like the other thing, just like the masks as well. Like I think visually, that difference as well. Like it must have been so hard. Patients there, wasn't there? Like just there was not enough facilities for it at the time. I mean, every country had a problem with it, but we had such a bad problem with that in the UK. Do you see the likely of that? I mean, this is getting political. I don't mean to, but do you think you could deal with that? Like, if you were a doctor at that time, like, what must be going through your head at that time?
It would be so infuriating, and it was the mixed messages. I think so. At the start, where the first doctors dealing with the first patients that had COVID had barely any PPE at all. Wow. And then the rules changed and it was like, you need to wear respirator masks and aprons and gloves and all these things. And the other doctor's like, well, I've just seen someone with just a normal mask. And those sorts of things are really scary. And then they had different rules. They basically organised it terribly, and the show highlights that. Yeah. Where it was like, if you were in the red zone, which is where all the COVID patients were put, you have full PPE. But then the non-red zone or the amber zone, whatever, if there might have been a COVID patient on, but because it's not the red zone, you're not in full PPE, but they're still a COVID patient.
They're partying in amber zone.
Exactly.
You know? Red zone, no, but you know, they're just having a good time. Damn, Ben, you remember that time? Were you in the UK in COVID? How was it in Gibraltar, man? How did they do it?
It was very different. Lockdown lasted a month, but a lot of people didn't really listen to it. A lot of people died. It was pretty bad with it. And,
there's a big old population there, isn't there? Damn.
Yeah.
Wow, that must have been crazy. Yeah, if I ever, I didn't have to go into hospital before, I was good. But what I was going to say before was, the point is they didn't know what it was at the time or what it could have gone on to be. So the fact that some people were just wearing regular masks at the start, I think that's what you were saying, is mental.
Yeah.
What is that? Do you know if we have like better organization for if it's going to happen again now? Because we've learned from it? No?
I hope.
I would hope so. And maybe if you do want to become a doctor a little bit quickly, we're not hoping for one, but it might help you become a doctor.
I definitely am not going to start wishing for that.
No, not hoping, but career-wise, no. Is there like a benefit to having the same GP like your whole life? This is one of my weird thoughts, but now that people are traveling more, now that people are going different places, it must be harder for doctors to know their patients, and you know, picking up on the fly must happen so more often now. And how is that dealt with? And maybe we could talk a bit about that.
Yeah, it's definitely true that having the same doctor that oversees, you know, your care is beneficial.
Yeah.
Because, I mean, sort of like I was saying earlier, if they know you as a person and they know your wishes and things like that, and they know you as a healthy person, so it's easier to know what you're like as an ill person or something like that. And yeah, I think it is, there's less of you have your family doctor that sees all your family and things. That's less of a thing now because we're just overrun with patients.
Yeah.
Well, that's not true, actually. There's not enough doctors.
Okay. Less people wanting to be doctors as well, or is that just as of current there are not enough doctors? Do you know?
I think
maybe we could have a look. Ben, how's the NHS looking in terms of capacity? How will we Google that? Maybe Google's probably not the best way, but like NHS capacity. Oh, it's got a capacity track. I wonder what that means. That's probably just your local checkup. But yeah, I've never heard anybody say the NHS is under a good state. I've never heard like, you know, the NHS is chilling right now. It's always well, in the last like 10 years, it's never been in a relaxed state, has it? And I find it very commendable that you want to get involved in such a thing like that, because one of my friends studies medicine and he wants to get involved in private because of the benefits of that. And what are the differences in, maybe you could talk between that and what they do and the difference in the role? Is there any?
Oh, it's just a completely different environment.
Right.
And I could never do it, I don't think. I mean, if the NHS were to partially privatise, which I think is probably quite likely, then that's fine as long as it retains its values. But I would never work completely private. It's just the fact that there's money involved. I worry that there's different motivations to what you're doing. Yeah, and I don't want to undermine people that like my peers that are choosing to do that. Yeah, but I think the idea that people should pay for healthcare is terrible, and I think the NHS is amazing.
Yeah, no, it's amazing. It's I maybe take it for granted way too much. I've been on the waiting list for my braces. I eventually got them, but it would have cost me thousands, and I'm not having to do that. I definitely wouldn't be able to afford it if I went private, you know. We're very lucky to have that in the UK. We're one of the countries, not many countries have that. I think we should take clap for the NHS a little more. You know? I found that a little weird, you know, clapping for the NHS. It seemed a little condescending,
it's
you know.
Awful.
There was always, down my street when we were clapping though, there was a local neighbour who would time his run for it though. Absolute wanker.
So yes, he was running down the road.
Well done, John. Yeah, we're definitely clapping for you, dude. Like, what?
No, I think most NHS workers hate the whole clap for the NHS thing, because it's like, well, actually make it better, maybe, rather than... Yeah. It's just ridiculous.
Reminds me of when they had that scheme of like work experience scheme to help stop unemployment. They were like, oh, we're gonna let people work for free, so we'll just let you work at pound stretcher. Kevin Bridges has an amazing joke where you're working in a shop where everything's worth £1 except you. It was fucking crazy. Yeah. But yeah, no, pandemonia. You got things going on in the hospital. Do you think that's where a doctor kind of shows his worth in a stressful situation? Do you think there's what things do you think we could be doing as patients to help, or even before we go to a doctor's, just to help you guys a little more, maybe? Maybe that's a lot of impossible questions I'm asking you today.
Well, there's a lot in there's a lot of pressure on various services, the ambulance service or A&E, various things, that, don't go if you don't need to. Go if you've broken your ankle. But
yeah, dude, Ben waited 4 weeks, like, this is fine, you know?
But I don't, it's hard to say.
Would you say, because sometimes someone educating themselves can hinder your own thing? Because I would have thought your response there was going to be like, be aware of your symptoms, like track things. I think that's one thing. Yeah. Like, I have a little mole on my foot. I was like, I'll take a picture of that now in case it develops into some crazy thing.
Yeah, that's very sensible.
Because then you've got like, and also it's objective. You can go, no, it has got bigger because look at that, look at this. And that's been a problem with me, like switching from different dentists, because everyone has a different opinion on things. And then that causes more time and delay. And then you have to book another appointment, which someone else could have gone in. You've got so many different like management problems as well. I think that's where a lot of it comes down to as well.
Yeah, certainly.
Bloody hell. God, we could get into all this. It's crazy, Ben, do you think next time you will go to the hospital a bit early, or maybe just visit Lauren? She'll probably, maybe, I don't know. Maybe don't visit Lauren. Not yet, in a couple of years' time.
Maybe, yeah.
Well, it's interesting. Sorry. It's interesting because what I've found now that I'm in third year, I've got a couple of years behind me. The one thing I'm good for is telling you whether you need to go to A&E or not.
Wow, okay.
So recently one of my friends went on holiday to Cuba.
Okay.
which is quite a long flight.
Yeah.
And something that can happen when you're on a long flight is you're at high risk of getting blood clots in your legs, mainly. It's called a DVT, if you've heard of it. And she just landed in Cuba, and she messaged me saying, Lauren, one of my legs is swollen. I was like, no, don't tell me this. And well, I didn't want to panic her. So I was just asking her questions like, are they both swollen? Is it just one? Is it red? Is it hot? Is it painful? Just like asking the questions I would ask if someone actually came into hospital. And she told me these things, sent me a picture. I was like, chill, you're fine. Like, don't worry.
Okay. So you know from a picture. That's pretty good.
I mean, I always have to say, but please go to the hospital if you're worried.
Yeah,
because
then they can't sue you, right?
Well, yeah.
Hell yeah.
Because, I mean, as a medical student, I can't give medical advice, basically.
Yeah, that must be always so annoying. You're at the pub every day and everyone's just like, oh, wait, can you check this out? You know, it's a joke.
You're meant to say no.
Yeah. That must be so annoying. That's like with any job, like people, if you're a comedian, you know, oh, tell us a joke. It's like the equivalent, like, oh, give me a checkup, you know?
Yeah.
Damn. That's crazy.
I've got this weird rash. Yes. Classic.
Yeah. Where do you draw the line on checking up on a friend, you know? Does it get to the upper thigh when you're like, okay, go to the, I'm not looking at that,
well,
you know?
I'm so desensitized to these things. I'm like, go on there.
Yeah, go on then. Take your top off.
Yeah.
Like, damn, yeah. I don't know if I'd be the same with the homies. I'd like to think if one of my buddies was, you know, had a little rash on his cock, I'd have a little look. Because now I've talked to you and I worked on Naked Attraction, and I'm very well. Maybe I've got some of that back, but during those couple months, I was fine seeing all that. You know, very sexually open people. Do you see a different expression on a patient's face if it is a sexually related issue? Have you ever had to deal with anything like with that? And that, just because I find it quite comical, I'm asking that question.
Yeah, I mean, the classic is if you're on surgery and there's a foreign object that's been placed somewhere it maybe shouldn't have been placed. And one of my friends was on placement on surgery and spoke to the patient, took a history from him. And he basically gave a completely false story that was medically inaccurate. And then we were like, yeah, that didn't happen. And then we looked at his x-ray and we were like, that's why you didn't say what happened.
Right, yeah. It seems to be up there a bit too much. Yeah. Damn. Yeah, I hear so many crazy stories about that. 9 out of 10, they're probably not going to give you a straight answer. Look, I was in the bathroom, I saw the toothbrush, you know. They're not going to give you that.
Yeah, but you need it.
Yeah, swallow your pride, tell them.
Yeah.
It's crazy as humans. Even though we know we're not going to see that person again, there's that sense of pride where we're like, no, I can't let them know that.
Yeah, I mean,
it's crazy.
There's also other things. Like, we ask patients about their poo all the time. Every patient, I'm like, and I've had several people being embarrassed to tell me they've had diarrhea or something like that, but that's crucial. I need to know that.
Yeah.
And I understand it. And
it's not like you're making conversation with them. Like,
yeah.
You are asking medically.
Any diarrhea lately? No. And I get it. I would also probably be the same. And for me, it is true. You know, if you're going to the doctor about something you find embarrassing and people say they've seen it before, like they've seen worse, they see it every day. It's so true.
Yeah.
I just would not, you shouldn't be embarrassed.
No, you shouldn't be embarrassed. Maybe there'll be a drug soon where we can just give people a truth serum, you know, give them that, give them a little bit of truth.
I'm not sure that's ethical.
No. Maybe that's why they don't let me. I didn't choose to go into medicine. I get a little bit, my morals aren't all there with that. You know, you've got to be immoral. Is there like anything with morals? Like you're taught a certain way. Is there like a handbook, you know? You know, in Christianity, you've got, the 10 Commandments, doctors, you know, 1, don't do this. Make sure to do this. You know, to any aspiring, doctors out there, Lauren, you got any advice?
Well, we do have a rule book, actually. The GMC, the General Medical Council, is our governing body, and they've got guidance for all doctors. And there's the main one is called Good Medical Practice, and they set out a set of guidelines about they're guidelines, but it's how you should act as a doctor and what you should do in certain situations. But it's an interesting point that I've talked about amongst my peers about whether you can teach people to be empathetic, because not everyone is, and not every medical student is, not every doctor is, although they should be.
Right.
And sometimes you hear I mean, anyone would see a doctor and be like, I'm not really sure you should be here.
Yeah.
But can you teach that, or do you need to be naturally understanding? Not sure.
Well, like psychopaths famously pretend to be empathetic, but
yeah,
they're not. So you can definitely fake empathy for a certain amount of time.
Yeah. I mean, we have communication classes.
Okay.
And ethics-based classes, and sort of, you know, what to do if you have an angry patient.
Yeah.
Or if someone's complaining or someone's upset. And we do and they do teach you how to be an active listener and things like that. But there is a sort of sense of, is that an innate ability?
Yeah.
But you can, and there's certain stock phrases, and you'll see people do this in exams when they're like, oh, you know, I'm really sorry to hear that. Or they'll just be sorry to hear that and move on.
Yeah, yeah.
You know,
it's about the delivery.
Are you actually sorry to hear that?
Yeah. Yeah, you wouldn't want to do that. And I feel like maybe you could get away with that more as well, because if the patient's not all there, you know, they may not care.
Well,
they do care. But what I'm trying to say is there's maybe not always accountability, because that's the problem with like lawsuits you see in hospitals and things like that. If you're not always with it, it's hard to recall what's happening. Sorry, I'm just coming at it from a patient's standpoint and where I've been. And yeah, you're right. I don't think you can train empathy. I think you can fake it, but I think after you've talked to someone for a certain amount of time, you can get a good judgment. But then again, there's some people who are amazing at judgment and not. So I don't think there's a simple answer to that, is there?
Not.
And by the sounds of what you've done, do you think you've had to teach yourself that empathy, or you're naturally inclined, you care about people's health?
I think I care.
So I was laughing at myself because that's ridiculous. But of course you have. Do you think you've become more caring now you've learned the more ways people can die, you know?
Well, yeah, I guess it's more about the more ways that people can be. But when you meet loads of different people, you're more likely to be able to understand someone's situation.
Yeah.
I mean, I come from a very privileged background, and I've seen patients who haven't, or, you know, other difficulties or different social whatever. So I think it's more about that, but I don't think I've had to learn how to be empathetic. I think that's the reason I'm here, is because I care about people.
You seen any like people, you know, on your course who missed the boat? You go, he's not going to make it. You know, he's not going to do that. You get a sense.
Don't want to talk badly about them, but I mean, sometimes you do hear someone say something, and you're like, "How did you get past the interview?"
Yeah,
but
what do you think me and Ben would make as doctors? You know, maybe you don't know us that much, but I think I'd be very good at, you know, getting how they're feeling. But maybe I feel like I can go off track very easily with any of my train of thought, and maybe I'd spend way too much time talking.
Well, that is a skill, but I think you've got the natural. You're very perceptive, you know.
Oh, okay.
You ask thoughtful questions, and I think that shows that you'd be a good doctor.
Well, my acting's really been developed. Hell yeah.
But one of the key skills of being a doctor is keeping patients on track. We're talking about GPs. You have a 10-minute appointment time. You're meant to keep to it. So you've got to find out what's going on, ask loads of questions, examine someone, and come up with what's wrong with them in 10 minutes. Yeah. So you can't spend time rambling. So there's a really careful balance of trying to build a rapport with someone and make sure they feel safe and calm and listened to, but also right, come on, I need
yeah, you gotta get that. That's why I was saying I was a little bit of a teacher's pet, where I was like, I kind of knew, I always like kind of had a rough idea of like my medical situation and what was going on. So that's what I was saying before about helping doctors. Maybe there's things you can be aware of medically, you can, before going in, that can save them time, like knowing this and that. But of course, the whole point of a doctor is to judge that and judge that information. Don't just go off that. But with the stress the NHS is under right now, I just had the idea that maybe if people got a little bit more educated and through this podcast learn what you guys do, maybe, you know, the two people listening could help speed up the process, you know?
Well, I guess. But it is difficult. And the NHS do run campaigns. I'm thinking of like the stroke one, where it's have you seen it? And it's called the FAST test.
Okay.
And there's been lots of adverts about it, but basically it lists FAST stands for face, arms, speech, and time to call 999.
Right.
Have you heard of this?
Yeah, I've heard of that one.
Yeah.
The last one's a little bit of a push. Jesus Christ. Quick time. The T's got a lot on it, you know? The T's got a lot. But yeah, maybe you want to talk a little bit more about that. That's one of the campaigns which is probably quite well known, right?
Yeah.
If you're smelling toast, it's probably not going to be good, right?
Well, that's a myth, but...
Is it a myth?
I think so.
Damn, okay. Because sometimes I'm like, is Declan cooking toast or am I having a stroke, right?
Yeah.
Also, another thing, I don't like to say toasting toast because I don't like that, you know, because is it... Sorry, I'm rambling. Toasting bread, there we go.
Toasting bread, yeah.
Damn. Is there, say, any other job that isn't in the medical field that has the most like transferable skills that you could go, okay, they like, if all the doctors died in the world, right, and one profession had to sub in?
Oh my gosh,
this isn't a clever question by any means. Who do you reckon's having a good shot? And maybe only 75 of the population will die. You know, maybe there'll be a couple people left. Because I'm thinking maybe a chef, maybe a chef because they know knives, you know, maybe they can get in there. I don't know, Ben, what do you think? You know, all the doctors die, all the people who know about health die. I'm thinking chef or like football coach personally, you know?
Where does that come from?
You know, like physical activity. I don't know, what, you have any ideas?
I've got nothing, mate.
Maybe.
I think we need to combine. So you've got like a scientist.
Okay.
I don't know, someone who
yeah, you got like a guy
vaguely aware of
something,
the body, and then mix it with like a retail worker, who can cope with, you know, like a people. Customer service person.
Yeah. Well, maybe me and you have that in common, that we both worked, or well, I still work in a grocery store. And you grew up in that. Now you're just dealing with customers in a slightly different way. You're just selling them maybe a bit more of their life back.
Yeah, you know? And I think there are definitely transferable skills.
Yeah.
But usually in the hospital, it's very different when you have someone that's angry to when someone that's angry in the supermarket. Because when they're angry in the supermarket, it's like, you sold me the wrong sausage. True story. And like yelling at you for something that's so insignificant.
Yeah.
It's like, I do not care about, I don't know what cereal you want. You know, but when it's someone who's ill or their family member's ill and they're getting angry at you, it's sort of like a behavior that's happened because they're stressed or they're scared or they're ill, and you can compartmentalize that a bit more and be like, okay, they're not actually angry at me, they're just, you know, upset.
Yeah, it's kind of more warranted, right? You know, if you see someone related to you or your partner, like if they're not getting the treatment you think they deserve, you know, you are maybe not the right person to talk to, but you're the person there, so you probably deal with that. Yeah, but it's a good way to treat it, and that's something else you've been taught, right? How to kind of deal with that. God, when we get angry customers, man, I don't know, sometimes I think sometimes you get angry customers in stores than you do bloody in the hospital. These people, all they want is a 20p refund and they get angry.
Oh my God,
you know? It is mental these days. But it kind of makes more sense why we're seeing more of that, just with the cost of living as well. I feel like everyone is maybe getting more caught up in smaller issues right now. Maybe it's a way of kind of distracting ourselves from what's going on around us and what's going on. But yeah, I do really appreciate what you guys do, and when you go like that, Lauren. Let me just have a little look, because I may have had a couple more questions for you. What is your favorite type of patient? Okay, you know, you can sound biased, but like when you see them, you're like, this is gonna be easy. Like what? Like, you know, you don't want a closed book. You don't want someone who's hard to read. I imagine it's quite like an open and honest person, like we were talking to before.
I think just when you feel like they're on your side, or like you're on the same page.
Yeah.
And then smiley and nice, I would say.
Wow.
But then I'd
be a little freaked out if they were like injured as fuck and they were just like,
well, that's true. I mean,
bit of a psycho, right?
Maybe I'd take that back.
It's within context, right?
Yeah, because if they're very ill, I don't expect anything of them.
Yeah.
So yeah, it's kind of a difficult one to say.
No, for sure. And a lot of these questions, you know, I like to say that, you know, Lauren, I'm asking a lot of questions. She's still studying. We don't mean to get. I don't know why I have to give this disclaimer. You're listening to me. Google your own stuff. You know, go to a doctor if you need help.
Yeah.
And Ben, maybe go a bit quicker than 4 weeks, mate. If you want to get sorted.
I thought it was a fracture.
And that's fine as well. It's a fracture. Yeah, it's fine.
Yeah.
Fair. I got my tonsils out when I was like 13 or 14. I woke up to my dad recording me. Imagine like you just like waking, like, okay, what is going on? And then he's just like asking me questions. That's something that they're hilarious to watch, but like, I don't know. That's crazy though, that you yourself have only been to the doctors like once or twice, or never before going into it. That's crazy. Maybe that means you go into it with like the least amount of trauma. That's probably a good thing. Yeah, because if you were like growing up in a hospital, it'd be hard to work in there if you have certain associated memories. My granddad, he has a fear of hospitals, and I find that really kind of like, if you look at that primistically, or like you know, in terms of looking after yourself, why does your body hate when someone's looking after you? And how do you deal with patients who scared of needles, the classic one, things like that? How would you navigate that?
Oh, it's difficult. Things like needles, usually they need it done. Like,
yeah.
So it's like a non-negotiable.
Yeah, like we're doing it.
But we're not going to do it. They've got capacity. We're not going to do it without their consent. So you've got to calmly persuade them that they need to do this. But it's sort of just reassuring them, not patronizing them. So it's like recognizing that their fear is valid.
Yeah.
And just trying to find a way to make it easier. It's quite difficult. But yeah, usually they'll come around.
Yeah. God,
but a lot of people don't want to be in hospital. It's very common, especially among older people, because I think the main worry is that they won't come out.
Yeah.
And that's really scary. So people want to get out of hospital as much as possible. And it's not the best place to be.
You probably are going to be more likely to tell a story to your friends about a negative story in the hospital than a positive story too. So, you know, in these conversations that they probably heard bad stories, or they know of someone like, you know, they associate it with negative things, and that puts you in a hard position sometimes.
I mean, it's the hardest, probably the worst thing that's happened to them. And especially because I want to be an A&E doctor, when that patient's coming to you, it could be the worst day of their life so far, you know. And so it's a real privilege to be the person that's trying to help them, I guess. And you have to bear in mind that this person is going through, like, the two weeks in hospital is probably the worst 2 weeks of their year, or something like that. Like, it's not going to be a good time for them.
No.
So it's understandable that they don't want to be there, or that they have bad associations.
No, very much so.
Have you ever had a patient who's too scared to get the medication that they need?
Yeah.
And just outrightly refuse to get that?
I'm not sure I've seen that. I'm not sure I've seen that in action, but I've certainly been involved with patients who have just refused a treatment, and you have the right to refuse treatment if you're of sound mind.
Right. So it's that judgment if they're in sound mind. But as soon as they're out of that, when does it get to a point where you have to then give them that treatment?
Well, we assess their mental capacity. The mental capacity assessment is a standardized proforma of questions. You basically have to assess whether someone can understand, retain, weigh up information enough to make a decision.
Right.
That's the basis of it. So if you decide that they can't do that, then it's either they might have a lasting power of attorney, they might have a dedicated family member that makes those decisions for them, or it's you as the doctor acting in their best interest.
No, that makes sense. Going off this and the rule book, and you're dealing with individual people, but by the sounds of it, you've learnt from a specific rule book, and that must mean that there's not different techniques, but the doctors. What I'm trying to ask is, there's a standardized thing, but what's the disparity in that? This may be another impossible question to ask, but I see doctors as these impenetrable, heroes who deal with anything, this, that, and that. Would the way, you said some of your family members that study medicine going to be a doctor, your version of being a doctor, would that be any different to say someone else? Do you get what I'm trying to ask?
I think a lot of doctors are all different,
right?
And there's, I guess, the medicine, the science doesn't really change, but your way of interacting with people and approaching people is the thing that's different, and that can lead to different results. And I've shadowed quite a few doctors and consultants who are the top of the food chain, as it were.
Yeah.
And I find that really useful to go and watch different people interacting with patients and thinking, is that the kind of doctor I want to be? Or sometimes thinking, don't want to be like that when I'm a doctor, and think it's
Wow. And then you could even go, Richard would be great with that patient. Lauren would be great with that patient.
Yeah.
That would be, but definitely the NHS do not have capacity for that now, do they? That's not another thing. But moving on to near the end of everything, where do you see where technologies is going, or early signs of new technology, and how that may change your role as a doctor? How futuristic proof is your job with AI, things like that? Does that ever cross your mind?
I think my career is safe. I don't think I'm gonna be out of a job in the future. Because AI is just unable to pick up on the intricacies of a human being.
No, for sure. I was more saying that certain areas of your job, or just right now when you see in a hospital the technological advances assisting you and things is there any of that you've come into contact with? Where's probably not.
Well, some hospitals I work at still have paper notes.
Wow.
So
maybe my idea is completely wrong. what we're looking at here.
It really depends. It's not really been relevant to me so far, I don't think.
Because I agree with you on that. I was talking to a psychologist and a therapist. Probably therapy is probably going to stay for a while. You need a human to talk to another human, right? Unless you're into robots. Maybe some people benefit from maybe have a little robot thing going on. No, there's probably some Discord kids who probably get some
maybe.
Yeah. Damn, man. I've had a lot of x-rays recently.
Okay.
How many x-rays before I start worrying about getting radiation cancer?
I actually don't know.
Can we Google that? Because the first... Sorry, this is really a tangent, but the first time I had it, it was for my teeth, but I had 3 within the same year one time. I was like, is this safe?
Yeah, I mean, every x-ray you have increases your risk very small
very
amount.
finely, but they all add up, you know?
But if you need it more than the risk, it's a risk benefit. It's always a risk benefit thing.
But there's not a tally. They don't know how many I've had, right?
Well, they should.
They should. Okay. Damn, yeah. Because if you're that's lucky, man. Because the inventors of it, famously just died, obviously just died of it because they didn't know the risks of it, right? How many x-rays a year is safe? There was no one number that is definitively safe, just as there's I
mean, x-rays are better than some other scanning.
Okay.
CT scans use a lot more radiation.
Is that a CT scan, the one with that
donut looking
one. Around the brain, around the head?
Anyway, it's like a donut and then you go through it.
Oh damn.
Yeah.
You're probably not in a good way if you're having to get one of them done.
They're quite common.
Oh, I might just go for a checkup then. Might go for a little CT. Can I? No?
Well.
No, okay. Well, no, that's cool. Ben, you got any questions for up and coming, hot shot?
I do actually. I was going to ask, going back to COVID, have you noticed any major changes in how students study medicine in a post-COVID society? Are there more restrictions now, or?
Do you mean restrictions for us?
Yeah.
After COVID? Well, we did a lot online as you guys would have. So that was very different, and a lot of people missed out on placements because they just weren't allowed in a hospital. But my experience has been pretty normal. But it is much more commonplace to just have a COVID patient on the ward. So it's obviously still around, and flu's probably a bigger problem again than COVID. I mean, but I'll just rock up to placement and they'll be like, oh, there's a COVID patient. Or sometimes you don't know and just happen to have looked at their notes after and it's like, oh, they had COVID and I just walked in their room. It's like, we're crazy. Quite relaxed about it.
Get them to wear you used to wear a dunce cap. Get them to wear a little COVID thing,
That would be not good.
Dude, when they put that wrist thing on with so when you get admitted, they put you probably call it a QR code, male 28 LE. I just felt like I was a piece of storage getting put into a unit. That made me feel like I was going to be there
forever.
Did you
not like that?
I don't know. I just felt like another number to them. They didn't treat me as a person.
Yeah, I mean it's just so we don't give you the wrong drug and things like that.
Yeah, no. But that was an interesting question talking about COVID.
I feel like I didn't answer it very well.
That's very honest of yourself. You that's nice. We were all about honesty on this. What do you think she could have done to answer that question better, Ben?
Well, I'm not a medical student, so
I
can't really gauge it.
You've been very critical of yourself, but who you're talking to here. You could just get away with anything,
Yeah. You could fabricate everything, and we'll be like, yeah, that sounds normal. Yeah.
Well, one thing I will say is that post-COVID, the biggest change has been using telephone consultations and more online things, and that's still happening. So if you want to see the GP now, usually you'll fill a form in or ring them up, and if they decide that your symptom is kind of minor, you'll have a phone consultation. Discuss. You might have had this. Discuss your problem with them, and then they'll decide based on that, do I need to see you or not?
Okay.
Because some things you can't properly manage someone unless you've actually seen them. So that's one thing. And, doing things by Zoom is very common now.
Yeah.
I don't like, I would, one of the things that makes me not want to be a GP now is I don't want to do that over the phone.
Yeah.
It just doesn't seem right to me.
Damn.
But
Zoom.
it's good for other reasons. And it widens access to healthcare because some people can't get to GPs very easily. Whether they don't drive or disabled people might find it more difficult, or, public transport's terrible usually. So they might miss appointments, and it's on the phone. They might actually attend them more. It might be easier for them.
Yeah, that wasn't the case for me with lectures. I was just clocking in, Zoom lectures or whatever, clocking in, and then I'd start taking notes, but I'd be doing it in bed. So then I'd just go, and then I'd wake up. I was the last one in the lecture, so then they knew I wasn't.
Oh my god!
Yeah, no, that was first year. But yeah, that's a really interesting thing, and that probably helps take the stress off the NHS. More GP.
Yeah, pros and cons.
And calling 111 instead of calling 999 if you have a cough, Susan, you're not dying. Okay, guys, we all need to just chill out. Okay, probably not going to have another pandemic, guys. Everything's going to be fine. You know, Lauren, you know, even a doctor's telling us everything's, no, she's not saying that. No, she's not saying that. But unless you guys have anything you want to talk about, that's everything I want to kind of talk before this light blows us up. We got some new lights in here. I really appreciate both of you coming on, and yeah, hopefully you've learned a lot from this episode. I definitely have learned a lot. Yeah, a lot, man. We will be back next week for you guys. We're back on it. We're back in it. We're available on TikTok, YouTube, Instagram, Ed Squared. Check out Ben. Thank you, Lauren. And yeah, see you guys.